Good day, I am Mr. Co Ronald, and I'm going to report about phenylketonuria. Phenylketonuria, also called PKU, is a rare genetic disease inherited as an autosomal recessive trait. It causes an amino acid called phenylalanine to build up in the body. Without the enzyme necessary to process phenylalanine, a dangerous buildup can develop when a person with PKU eats foods that contain protein or eats aspartame, an artificial sweetener. This can eventually lead to serious health problems. For etiology and cause, absence of the enzyme phenylalanine hydroxylase, which is necessary to convert phenylalanine as an essential amino acid into tyrosine. PKU is caused by a defect in the gene that helps create the enzyme needed to break down phenylalanine. Without the enzyme necessary to process phenylalanine, a dangerous buildup can develop when a person with PKU eats foods that contain protein or eats aspartame, an artificial sweetener. Most forms of PKU are caused by mutations in the PH gene on chromosome. Untreated PKU is associated with an abnormal phenotype which includes growth failure, poor skin pigmentation, microcephaly, seizures, global developmental delay, and severe intellectual impairment. For types of PKU, hyperphenylaninemia, the lowest level above normal. Mild PKU, blood levels are mildly elevated. For moderate or variant, levels are not low but not high. And for classic PKU, blood levels of phenylalanine are high. Here we have the disease process shown on the diagram. For risk assessment, classical PKU is an autosomal recessive disorder caused by mutations in both alleles of the gene for phenylalanine hydroxylase found on chromosome 12. In the body, phenylalanine hydroxylase converts the amino acid phenylalanine to tyrosine, another amino acid. For signs and symptoms, a typical musty or mousy urine odor that is so strong that it often pervades not only the urine but the entire child. Blue-eyed with very fair skin and light blonde hair child. And also growth failure, frequent vomiting, irritability, hyperactivity, and unpredictable and erratic behavior, and also skin is prone to eczema. Older children commonly displays bizarre or schizoid behaviors patterns such as fright reactions, screaming episodes, head banging, arm biting, disorientation, failure to respond to strong stimuli, and spasticity or catatonia-like positions. For diagnostic tests, Guthrie inhibition assay test, it is a diagnostic tool to test infants for phenylketonuria a few days after birth. To administer the Guthrie test, doctors use Guthrie cards to collect capillary blood from an infant's heel, and the cards are saved for later testing. And also urine tests. Results of urine tests may be negative in the first month of life and are rarely used in current practice. For nursing diagnosis, first is altered thought processes, difficulty in talking related to poor intellectual abilities, and second is disorganized infant behavior related to congenital or genetic disorder, and third is risk for injury related to extreme hyperactivity and gait disturbance. For nursing management, teach the family regarding the dietary restrictions. Inform family caregivers of the foods that they should avoid giving the infant once he is allowed to take solid foods. Special formulas are also indicated instead of regular formulas or breast milk, such as lofenalac and phenol-free formulas. Offer support to the family emotionally, especially after the diagnosis, so they could cope with the shock, anxiety, and stress. Educate the family on the disease process and how they could help the child grow as normally as he could. If a child's phenylalanine control is kept within the acceptable range, growth and development will not be affected. Educate the family caregivers on how to handle the child, with safety being the priority in case of convulsions, so that the family will have knowledge on how to handle the child with safety and how to handle it properly. And also monitor vital signs to detect any abnormalities and monitor medical problems. For medical management, Guthrie bacterial inhibition assay test. This screening uses blood from a simple heel prick. The test is most reliable after the newborn has ingested some form of protein. The accepted practice is to perform the test on the second or third day of life. Bacillus subtilis present in the culture medium grows if the blood contains an excessive amount of phenylalanine. And for newborn screening test, this screening test is most reliable if the blood sample is taken after the infant has ingested a source of protein. For plasma phenylalanine, a qualified laboratory should measure plasma phenylalanine and tyrosine. Screening for PKU includes determination of phenylalanine levels, the standard amino acid analysis done by means of ion exchange, chromatography, or tandem mass spectrometry. Phenylalanine-free formulas. A formula low in phenylalanine should be started as soon as the condition is detected. Lofenalac and phenyl-free are low phenylalanine formulas. Best results are obtained if the special formula is started before the newborn is 3 weeks of age. Restricted diet. A low phenylalanine diet is a very restricted one. Foods to be omitted are breads, meat, fish, dairy products, nuts, legumes. The child remains on the diet at least into early adulthood, and it may even be recommended indefinitely. Amino acid supplementation. Other essential amino acids are supplemented using various medical foods, and vitamin, mineral, and other micronutrients are followed closely. Stringent phenylalanine restricted diets have been reported to cause deficiencies of iron, zinc, selenium, and other nutrients and essential amino acids in patients with PKU. And avoidance of aspartame. Aspartame must also be avoided. Phenylalanine is one of the primary components of aspartame. It is found in many artificially sweetened foods and soft drinks, as well as some vitamins and medicines. For pharmacological management, sapropterin. Some patients with PKU experience significant lowering of plasma phenylalanine levels after administration of sapropterin, a commercially available FDA-approved form of the tetrahydrobiopterin cofactor. And also enzyme therapy. An alternative enzyme therapy for PKU in clinical trials involves the use of an injectable form of phenylalanine ammonium lyase, an enzyme capable of substituting for phenylalanine hydroxylase. This therapy is currently under investigation for the potential treatment of patients with PKU who do not respond to BH4. For the nursing care plan, for needs problems and cues, physiologic deficit, altered thought processes. For objective cues, difficulty in talking, seizures, hyperactivity, delayed development, behavioral and emotional instability. For subjective cues, murag maglisod lagi makastorya ako anak unya maglisod sad kog pakaon. Basig naa ni siya depresya as verbalized by the mother. And for nursing diagnosis, altered thought processes, difficulty in talking related to poor intellectual abilities. For scientific basis, reduced PAH activity results in significant hyperphenylanemia, which leads to alterations in cerebral myelin and protein synthesis, as well as reduced levels of serotonin, dopamine, and noradrenaline in the brain. When untreated, brain development is grossly disrupted, and significant intellectual impairment and behavioral disturbance occur. For general objectives, after a week of holistic nurse-patient interaction, the client will be able to respond to reality-based interactions initiated by others. And for specific objectives, after 8 hours of student-nurse-client interaction, the neonate and the significant others will participate in planned activities. For nursing interventions, measures to achieve cooperation from the neonate and the significant others. First is provide safety measures. Example, side rails, padding as necessary, close supervision, seizure precautions as indicated. It is always necessary to consider the safety of the patient with mental retardation. Second is schedule structured activity and rest periods. This provides stimulation while reducing fatigue. Third, provide nutritionally balanced diet, incorporating patients' preferences as able. This enhance intake and general well-being. Fourth is maintain a pleasant and quiet environment and approach a patient in a slow and calm manner. Patient may respond with anxious or aggressive behaviors if startled or overstimulated. 6. Be consistent in setting expectations, enforcing rules, and so forth. Clear and consistent limits provide a secure structure for the patient. 7. Assist patient and significant other develop plan of care when problems are progressive or long term. Advanced planning enhances management of patient in home setting. 8th, engage patient to verbalize true feelings, avoid becoming defensive when angry feelings are directed at him or her. Verbalization of feelings in a non-threatening environment may help patient come to terms with long unresolved. 9th, assess dietary intake and nutritional status. This helps in identifying contributing factors. 10th, perform periodic neurological and behavioral assessments as indicated and compare with baseline. Early recognition of changes promotes proactive modifications to plan of care.